Okay, good afternoon, everyone. I'm going to talk about a project that is a collaboration between the academic side of work and also with the frontline knowledge transfer project in mainland China. So, okay. Let me try. So let me start with, we are in Asia. And I think people in this audience would know, well, that Asia has the highest number of natural disasters as reported in the risk trend report. And also, usually, we all know it's the ethnic minority community that are most affected post-disaster because of the lack of resources and the vulnerability. And many public health interventions, because I am doing health, and so I want to highlight that, is actually an effective strategy to reduce risk and impact. But unfortunately, a lot of communities has no access to these basic concepts because simply policies did not ingrain how evidence-based are their public health interventions. And potentially with climate change, the need of such policy strategy will be more intense, and as a result, my little unit, it's a collaboration between Chinese University of Hong Kong and also Oxford University with the emphasis of putting together both academic, frontline groups, and civil society to do something meaningful. And essentially, the center is a platform for research and training, but also community groups to work together to solve problems. The main theme of such research is related to how we use bottom-up approach. We work with communities, and what we try to do is to ensure those methodology, those projects are evidence-based. So these are some of the research evidence we identified and programs we try to build in order to ensure our work in the front line, our programs with the front line, with our partner groups may be meaningful. For instance, what makes warning effective? Or for instance, how do we help communities to conceptualize emergency risk? Because in many of the reports published for this conference, it highlights that it's important to translate information to knowledge. But what are the evidence base? How do you do it? So that is one element that we are trying to work on. So these are just, a repertoire of what we do. But essentially for today, in view of time, I want to highlight specific to you a specific project that we hold dearly. We have been working on this project since 2009, and this is by working together with provincial government, with local community groups, and with the support of local villages that we managed to build it. But in order to give you a three-dimensional view of what it is, I have a 5-minute video for you to share with you. Okay, video, please.
少数民族健康计划呢，是从2009年就已经开始了。我们希望在中国偏远的少数民族地区，特别是一些灾害频发的地区呢，做一些相关的健康教育工作以及防灾备灾的工作。希望通过我们的工作呢，让当地的村民在遇到突发事件或者灾害的时候，能够更加有效地保护自己。 这一次具体到云南，我们也同当地的学术机构以及我们省 CDC 开展了一个培训班。那么希望给同学一个在真正进入社区之前有一个培训以及一个讨论的机会吧。
所以我想大家去理解一个知识和智慧，它真的不是一回事情。所以当我们到农村去看到那些不识字的农民、老大爷、老大妈的时候，真的不要有优越感。 就是对于人生，可能他比我们看得透彻得多，所以这是我特别想跟大家分享的一个东西。
那么来到这个村子以后呢，首先是由我们的老师及医生带领我们的学生呢进行了一些入户的访问，一方面呢是希望了解他们的健康以及生活的状况，为我们的循证医学研究呢收集一些相关的数据，另外也希望宣传一下我们在后面几天想要开展的健康教育工作，希望能通过这个工作呢改善社区的防灾抗灾的能力。
知道一般在这里老人家他有什么病啊？ one of my important tasks was to assess the medical needs of this village. So I interviewed different people. This includes director of the township clinic, and also when I came here, we visited different homes of the villages. So we asked the village people what was the general common medical problems the elderly is facing.
那么这其中呢，包括话剧，以及一些海报的展示，包括邀请村民上台做一些演示或者一些游戏。那么通过这种寓教于乐的活动呢，希望让村民能够吸收到更多的知识。
As doctor, you can see you do your best, you work very hard. You can see say 20 cases each day. That's it. But if you have really competent public health personnel with a passion and a vision, perspective, with a heart, it can really help the lives of individuals. So this is actually my conviction.
呢啲年青人，呢啲嘅機會係好珍貴，佢哋有咁嘅機會係喺佢哋 postgraduate 或者 undergraduate 嘅 level 就已經有機會參與呢啲 community work。我希望佢哋可以喺呢度可以 get 到一啲嘢。我覺得其實學習最多、收穫最多嘅都係一啲學生。
希望人道主義救援的這個理論能夠更多的被灌輸到中國的普通百姓的心目中，也希望這個理念能被更廣、更快的推廣出去。
The CCOUC's journeys to poor and remote rural communities deficient in basic medical facilities provide precious opportunities for medical students to still their will, to learn humbleness, sacrifice, and team spirit.
I think education is an important part of civilization. The type of work we are building in the village is an attempt to pass the torch on. Insight is a function of experience and exposure. As teacher, in the minimum, we should at least give them exposure so that they can gain their own experience and know that they can do whatever meaningful if they decide to do so. Okay, so if I may continue to share, the program itself is actually very simple, but the way we put it together is we actually bring along the medical workers to go to the front line to see by themselves. Essentially, the idea is that we build programs in communities with their support for 18 to 24 months. And essentially, what we do is that we choose communities that are remote, rural, disaster-prone, and most important of all, there's simply not much evidence lying around to talk about how do you do disaster-prone, resilient communities. So what we try to do is to do all the technical bits of it, do a need assessment, identify the local relevance, and try to track what's happened to the community. And there are many things we do in the community, but disaster risk and climate change is definitely one of the important aspects. And we will do it through interventions. We do drama. We would do school-based activities. We present souvenirs, and we do poster presentation. And we would track in 6 months, 12 months, 18 months, what's happened to the community. Specific to disaster, we would support the community to prepare disaster preparedness kit. So we go and take pictures of a family, and let them put it in their bags, because if there is a disaster happen, how are they going to search for their family? We know that chronic disease is a major issue for the 21st century, and it's impossible for communities with low literacy level to explain what are the medication they are having. So we go to the household to take pictures of their medications and put it in the bag, so that when things happen, they can show the picture to the community what's happening. And we also teach very basic things like oral rehydration therapy. It would be used or solution. It's useful even for regular use because of the high prevalence of diarrhea. So we build healthy village, but in addition, disaster risk resilient communities. So we find a number of things. People always said poor people, no resources, so no money to prepare. But what is the opportunity missed is that we realize actually less than 40% or more than 40% of the community, to be exact, basically have never heard of the idea of disaster preparedness kit. Second of all, even though we know oral rehydration solution is simple, sugar, salt, clean water, but over 90% of communities in rural China has never heard about it. And third of all, we also realize in communities, even though you assume it's disaster prone, there is this interesting dynamic saying, if there is a community, there are households who are affected, households that are not affected in the previous disaster. In fact, the households that are affected last time are more likely to prepare. It's actually counterintuitive because right after disaster, you give resources to households that were affected, but you usually neglect those other households who were not destroyed, not affected. But you assume that they're okay this time. But when preparedness measures come into play, you should always try to support those households that was not affected this time, because what we found was that they are less likely to be prepared. So this is where we are. We are in the Western provinces, where all the ethnic minority group and the traditional poor, resource-limited communities are. We are building the evidence, and we're partnering with our government and NGO counterparts to build it in a more sustainable way and for scaling up. The video I was just sharing is actually in very close to Golden Triangle, Yunnan, and the border town. And it's important because in that province, there are annually one of the highest density of disaster in China. And potentially, if meant to prove ORS solution actually works, people actually remembers, and actually it proved that diarrhea could be reduced. In fact, there would be a scale up. But that was something that we are very eager and very excited to do. So this is so far the impact. Traditionally, we always say that the villagers and the participants are important. They are no doubt very important. But in fact, they are the teachers for all the frontline workers of what to do. And as a result, we believe this program not only support the village, they're actually teaching us. They join hands with us to be teachers of the 21st century frontline workers as well. So much is being said. I'm happy to answer any question. Anyone who's interested, that is the website. And we have some information leaflet out there. Any question? Okay. If not, thank you very much, and hope that you can visit our website to learn more about our project.